So, very good afternoon all doctors, all respected professors, deans, associate professor, respected principals, and all those students from various colleges of Pan India who have joined to this mega webinar on the occasion of World Hepatitis Day. We all aware World Hepatitis Day is recognized annually on 20th July. This is the day is really an opportunity to understand about the global burden of hepatitis and spread the awareness towards public. Even World Health Assembly endorsed this increasing global burden of hepatitis as a public threat, and we as a medical profession, means we pharma organizations and all doctors together surely can minimize and eventually can eliminate this dreadful hepatitis from the not only from India, from global end. So, all doctors once again welcome. I Prashant Evale, a marketing head of Charak Pharma, Mumbai, welcome you for this live webinar. And objective of this live webinar is to exchange and share the more insights about this global burden of hepatitis. And today or this year, coincidentally, Charak Pharmaceutical also celebrating 75th year of research, quality and trust. Yes, way back in 1947, Honorable Shroff Brothers has incepted Charak Pharmaceutical in India, and today after 75 years of glorious journey, we definitely express our gratitude to all medical fraternity who has kept the spirit of Ayurveda live in India along with Charak. And today Charak is known as a leading name in developing, manufacturing and in distributing proprietary herbal formulations derived from principles of Ayurveda. Charak today offers a large range of products with proven efficacy and safety. Just to mention, Charak Pharmaceutical grabbed various national awards especially for the quality manufacturing of Ayurvedic brands. And just to mention, in recent past, last year 2021, the Economic Times has awarded Charak Pharma as a Best Brand Award. Across India, at 3 different places, we have the state-of-the-art manufacturing units with well-trained staff. Colleagues, friends, doctors, quality is always our topmost priority, as all the products gets manufactured in WHO GMP certified plant, wherein we at Charak ensures international quality standard. Even our research and development labs are accredited by Department of Science and Technology, Government of India. Very special to mention, phytoactive marking and standardization process we do strictly follow to offer your patient optimal efficacy from our products. And thus Charak products are not only trusted, accepted, tested by medical practitioner not only in India but across the globe, and we have our footprints at more than 35 countries. All the products at Charak underwent lot of clinical human trials, and these trials are conducted by renowned doctors and institutes. And today Charak offers a whole bunch of Ayurveda products for all systemic disorders with multiple dosage forms and various packaging options, with one endeavor to provide 100% natural, safe and effective medicine to your patients. Actually, doctors, there is a lot to talk about Charak, but I will cut it short here and I will come to the agenda. And today I take this privilege and opportunity to introduce our esteemed speaker for today's mega webinar, happening on the occasion of World Hepatitis Day, and wherein our speaker is going to speak on current Ayurvedic approach in managing hepatitis. So, I take the opportunity to welcome our esteemed speaker, that is none other than Dr. Sunil Inamdar. I think sir needs no introduction, but however, I just want to give some brief about sir. Dr. Sunil Inamdar is a merit holder at University Examinations of BMS. Sir is gold medalist in MD Ayuda exams. Sir has done his post graduation from Jamnagar, Gujarat, which is a prestigious college in Rasashastra and Baisajya Kalpana. Dr. Sunil Inamdar has a lot of awards, rewards and recognition to his credit. Few to mention like Vaidya Khadiwale Panchakarma Puraskar from Pune in 2008 and AVP Award for Excellence in Ayurveda Physician, which has been given by Governor of Maharashtra. So, we are very fortunate to have such a wonderful speaker with us, who is believing, sharing and exchanging the knowledge and experience to his fellow colleagues and the students, and to keep his passion alive. He is also a professor at Ayurvedic Medical College, Gadinglaj, Kolhapur, which is in Maharashtra state of India. Sir is also a consultant at Sukhayu Ayurved Panchakarma Kendra, Kolhapur. So, in fact, Dr. Sunil Inamdar requires no introduction. So, without wasting much of your time, your valuable time, so first of all, we at Charak express our gratitude for your valuable presence and support to the Charak company, and I request now our esteemed speaker Dr. Sunil Inamdar to keep the ball rolling. So, I hand over session to our speaker Dr. Sunil Inamdar. Sir, now over to you.
Thank you, Mr. Prashant, and thank you all Charak team for giving me this opportunity. I am thankful to the all Charak members, all my dear and near members, those who have gathered and taken a lot of efforts to do this seminar, mega seminar in a big way. Dear friends, yes, today's topic is current Ayurvedic approach in managing hepatitis. So, today 20th August is a great day. It's a coincidence day. It's 75 years of Charak, 75 years of India, as well as today is a basic day. Today is another day which is described as a Amavasya or Alcohol Amavasya. So, this is also one of the great incidents today. So, here as a part of our lecture, we will start our lecture with Mangalacharan. Shankham Chakram Jalaukam Dadamram Charudorbish Chaturbi Sukshma Swachhatirudyam Shukaparivilasan Maulimam Bhojanetram Kalambhodo Julangam Kaditatulasat Charupi Tambaradhyam Vande Dhanvantarim Tam Nikhilagadavanam Praudadavagnililam Ragadirogan Satatanushaktan Asheshakaya Prasusan Asheshan Autsukya Mohartidan Jagana Yopuro Vaidyaya Namosu Tasmai Yasyananda Bhavena Mangalakala Sambhavitana Spurat Namna Siddharsamrutena Kuruna Viksha Sudha Sindhuna Bhaktanam Prabhava Prasamrti Jara Ragadi Rogakshana Shantim Yanti Jagat Pradhana Vishray Tasmai Parasmai Namah. There are some Drushta Shaktis and Adrushta Shaktis. To get the help of all Adrushta Shaktis, we start with our Mangalachar. So, our today's topic is managing hepatitis. But in Ayurveda, it is written that Rogam Adau Pariksheta Tato Anantaram Aushadam. That's why we first go for the disease introduction. So, hepatitis. By this name, we couldn't analyze any picture. But this picture, whenever the hepatitis word you will hear, it will be in front of your eyes. This is Bruce Samuel Bloomberg, an American physician, co-recipient of Nobel Prize who work on hepatitis B. He is born on 20th August 1925 and died on 5th April 2011. So, in these 85 years, all the years he was worked on this hepatitis B. In 1966, he invented hepatitis B virus. In 1968, he invented hepatitis B vaccine also, and for that work he was awarded in 1976 hepatitis B. So, his through life he is devoted for this institute. So, we have to ask one question to us, whether we have got this much passion to work in the specific field. Now, the world is going to be precise and evidence based. So, he worked evidence and precise work. That is why now they are having an institute still running with his name. Likewise, rather than from individualism, we have to come on the institutional level for each and every fraction of disease or each and every disease, and in the institutional manner with the Ayurvedic perspective. Then only we can have the next Nobel Prize from our side for hepatitis or any other disease occurring in the world. So, we will not much more waste our time on this topic. So, today we know liver is the employee of the month, because this month maximum people now they are having this hepatitis, celebrating this hepatitis day. This hepatitis day is always celebrated with the help of hepatitis preventing all the measures. But in India, 28 days now, which is a Deepa Amavasya, is celebrated as a alcohol Amavasya. Maximum people will engulf interest. That is why he is the employee of the month today, because lot of people their liver will work maximum in this week. Because next Shravan month it is there, so many people will keep abstained from alcohol and other meats and other things which will burden to a liver. So, just we will take this message from home. This will be our last Amavasya. From next we will take care of our liver, because it is the second largest organs in our body. Skin is the first largest organ in our body and second largest in human body. The best thing regarding liver than any other organ in our body is it can regenerate completely. Even if you donate a liver, that part can be regenerated again completely. 10% of liver contains fat. It aids in blood clotting. There are so many functions ascertained to it. It is as big as football. Liver conditions are mostly symptomless. So many patients just go to the investigations for their insurance policies or routine general checkup, and then they will come to know they are having hepatitis B or they are having some derangement in liver functions, and they come to know. So, sometimes this is a symptomless disease also. Now, we have to take care of that. So, regarding Ayurvedic perspective, first we have to understand the disease, and for understanding the disease we have to understanding its utpatti before the chikitsa. That is why in Ayurveda it is written that it is a matruja bhava. Liver is produced from matruja bhava, from rakta. Tatra samanena adhmayamanasya dehoshmana pachamanitasya shonisasya achyato jayata yakruta plihacha. That means achya part, that is the sar bhaga. That is why dhatu sarata is much more important. If your rakta dhatu is sar, even then you can avoid this disease. So, all our people should keep aim that their rakta dhatu should be sarvan to avoid liver disorders. That is a simple message we can get from its embryology. It is in the right hypochondriac region, that all we know. So, we will not much more time on anatomy, but it is a dakshinato yakrut klomacha panchadasha kosthangane. Within this panchadasha kosthangas, liver is mentioned as one organ. It is mentioned, but by simple eyes we can examine the liver, but from inside there is a liver lobule structure, liver acini structure. Liver is compromised a lot of hepatocytes as well as Kupffer cells that will protect liver, as well as stellate cells, as well as some blood vessel cells and other cells. So, altogether this part will make a liver and make a liver as a best organ in the body. So, what are the functions they are performed in our liver? Basically, rasavahanam srutasam Hridayam Moolam Dashacha Dhamanyaha Shonitavahanam Srutasam Yakrut Milam Plihacha. To understand the liver, it is the main site or Udbhavasthan of Shonitava Strutas. So, Yakrut and Pliha are considered as a Moolasthana of Raktava Strutas. So, anything which is going to affect on Rakta Dhatu, that will effect on Yakrut and Pliha. So, all the things we have to take care of purification of blood, then only we can understand and they can keep our liver in a better way. So, it is given that in physiology, Sakhalu apyo raso yakrut plihana uprapya ragam upaiti yakrute rakta dhatu kalayam shonitam bhavati. But see, Khalu apyo raso, that ahara rasa, after getting through the gastrointestinal tract, it comes through the portal vein. So, all the gastrointestinal tract, spleen, then stomach, then pancreas and other systems that get drained, whatever nutrients we are taken, that nutrient rich portion comes to the liver and there it get transformed. So, ahara rasasya transformation part is taken place in the liver. So, that is the Posha Rakta Dhatu it is considered as. It gives origin to Raksa, Rakta, Mausa, Meda, Asti, Majja, Shukra. So, every Dhatu he is having is nutrition part in Yakrut and Pliha, basically in Yakrut. So, Prinanam, Jivanam, Lepaha, Sneho, Dharan, Purane, Garbhotpadash, Dhatunam, Sreshtam, Karma, all these functions are aided by liver only. This is the Ayurvedic perspective you have to keep in mind. Rakta Dhatu means in liver there is a carbohydrate metabolism takes place. Glucose, gluconeogenesis, these are the places in carbohydrate metabolism. Then protein metabolism, as well as the amino acids are produced in the liver, urea is produced in the liver, as well as fat, which is the base part of the liver, cholesterol that is produced in the liver with the bile, and that cholesterol plays main important role to bind all the proteins also and to give a substantial form of all the hormones and others are produced by the help of cholesterol that takes place in the liver, as well as immunoglobulins that are also produced in liver. So, all our body is related with the liver, all their requirements are produced, are supplied by the liver very effectively. So, anything which is required in our body can be supplied by liver, mostly that every organ is nearly have a good relation with the liver. Near about 500 functions are liver related. That is why liver cannot be replaced in total. Liver cannot be like dialysis or anything, that will not help in a fulfill functions. So, all the metabolic processes, formation of RBCs in fetal life, as well as all blood components having the proteins, albumin, globulin that are also, then all type of hormones, then vitamin A, D, E, K, all fat soluble vitamins, they are stored in liver in a good way. As well as with all these metabolic functions, the main important function of liver is to excrete the bile. Bile is a most toxic agent produced in our bile, which is excreted through liver, by liver in liver canaliculi, and after that it comes into the gallbladder and then it gets eliminated in the gastric tract. That is a most important and very complicated part which liver does. No any other organ has this much responsibility. So, whatever bile is formed or whatever bile is formed in our body, that bilirubin has to be formed in the body, that is to be excreted, to excrete the bile. This is the main excretory function of the liver which gets disturbed in this disease hepatitis. So, we understand all these liver functions in a better way when we get deranged, then we will understand the importance of the liver. According to Ayurveda, liver comes like in amashaya, tatra amashaya, panchamakshaya, madhyagam. Tatra main tatra pitra dosha is mentioned. That means pittam panchatmakam tatra pakvamashe madhyagam panchamutaatmake yat teijaso gunadayat tyaktadravatvam pakadi karmana anala shabdam pachatanyam vibhajate sarakitto prathasa. So, sarakitta vibhajan, that place take with the help of saban vayu, with the help of kledak kaf, with the help of all these Pachak Pitta are taken place, and with the help of Ranjak Pitta it is taken place in the liver. So, liver is related with the all Pitta Dhatu. That is why all liver symptoms that you can observe in Alochaka Pitta, then Bhrajaka Pitta, sometimes in Sadhaka Pitta, then Pachak, and all this Ranjak Pitta. So, this Pitta Vikruti that we can observe in hepatitis. So, it is very important to understand all these things. So, here we can see that Kitta and Sara Vibhajan is the main function, like the Samanvayus function, Annam Grunhati Pachati Vivecheti Munchati, that can be observed in a better sense in this biliary tree. So, whatever bile is produced, that will be connected into biliary canaliculi. From biliary canaliculi it comes into the biliary ductules. From biliary ductules it comes into the right hepatic duct, then the left hepatic duct, right and left hepatic duct joins and brings the common hepatic duct. It comes and joins with the cystic duct, that it comes into the common bile duct, it comes to the pancreatic duct at the ampulla of Vater where the sphincter of Oddi is there, and then it reaches into the koshtha. So, this is the way how bile is produced in the liver. So, anything which produces obstructions in this way produces liver disorder known as a jaundice or hepatitis. So, what happens generally in our cases, anything when we understand, by Aristotle has given that if you claim that you understand something, you must understand the rudiments, you must understand the fundamentals, you must understand the aptopadesh given by the text. Previously our texts have given us aptopadesh about Kamala, Shakha Kosthashrita Kamala, Ruddha Kamala, Halimaka, Halimaka, Kumbha Kamala, only these things are mentioned in our text. But today's scenario, this is a current approach. So, today what we know is inherited. So, bilirubin is produced and excreted in the liver, that is the main function, gets hampered in this disease hepatitis. That is why we should understand all liver functions or all liver disease, they are manifested mainly, that is the main hallmark is a jaundice. So, it is produced. So, today we know, it is said that what our mind does not know, eyes do not see. So, our mind, when seeing a patient through the Ayurvedic perspective also, our mind should know all these modern aspects which are related with that. So, important is inherited hyperbilirubinemia. Then most important causes are viral hepatitis, autoimmune hepatitis, then liver diseases, alcoholic liver diseases, then alcoholic fatty liver diseases, then cholestatic syndromes, then drug-induced hepatitis, vascular injuries and mass lesions. These are the main important parts are observed in that. So, there are some pre-hepatic causes, there are some hepatic causes, there are intrahepatic causes or transformation factoring causes, and there are biliary some causes, causes related to the biliary system, or that is called as cholesterol. So, while understanding all these things, we should always keep all the things in our mind that inherited hyperbilirubinemia are having due to the genetic defects. Some people, they may have a Gilbert syndrome. So, whatever genes we are getting in both father from that genetic defect like Gilbert syndrome, slight elevation in the bilirubin happens in some patients, that is in 2 to 5% patients. Normally, they will show some symptoms of hyperbilirubinemia, but that does not cause any hepatocellular damage. That is why this type of patient, that does not need any symptom, it is an innocent disease. But whenever it is moderate or severely impaired gene product there, then it may produce Crigler-Najjar syndrome type 2 or type 1. Whether it is a moderate, it is type 2, and when it is severe, it become very severe, and that child may not live for the longer period. He cannot see his first birthday also. So, these are the very severe. Dubin-Johnson's, Ratter syndromes, these are also transporting agents, but these defects can also need no line of treatment. The most important part today, see, the liver gets mostly affected by the viral hepatitis. We will see our next slides how we should tackle with this all hepatitis syndrome. The most important another cause today we find is autoimmune disease, that our immunity gets hampered, and due to our immunity mostly these disease are produced disease in some biliary obstruction type, and that primary biliary cholangitis, the AMA test is positive in those patients, then autoimmune hepatitis we can observe. Genetic liver disease like alpha trypsin deficiency having some lung disease, hematochromosis patient having hemosiderin, that means so the treatment is heart transplant for them. Then Wilson's disease, then another some diseases where we can, but today we are not going in details of these diseases. The most important part for viral hepatitis, alcoholic hepatitis is another one of the major cause which produces fatty liver and hepatitis. So, we will see how it should be treated in future. Another most important cause we find is drug-induced hepatitis, that is hepatocellular pattern is formed in isoniazid or acetaminophen, that is a paracetamol toxicity. Cholestatic patterns can be seen in methyl testosterone type pattern. Then mixed patterns can be seen in the sulfonamides and phenantoin type, and major micro and macrovascular steatosis happens in methotrexate cases. Now, lot of patients they are taking anti-rheumatoid treatments and treatment for their arthritis are getting methotrexate for years together, and they develop this drug-induced liver hepatitis, which can have good results with the Ayurvedic treatment. The vascular injuries are also one of the main reason which produces severe pain like ischemic hepatitis, and one of the most important thing which can be easily ruled out with the help of sonography or with the help of MRCP or ERCP, that is the hepatocellular carcinoma, cholangiocarcinoma or adenocarcinoma or growth or cyst, abscess or gallstones and another or hemangiomas in the liver. So, hepatitis we have seen a lot of broad spectrum view regarding that, but practically what we can see and what we can observe, these are the main. In symptoms we can see pale color stool and dark urine, that is the most obstructive, then icterus, that is the yellowness in the skin, and unexplained weight loss, general appetite, fatigue, malaise, there are some symptoms. So, all these symptoms are divided into some constitutional symptoms like fatigue, that is the afternoon fatigue most commonly and like that, and another symptoms are liver specific symptoms which we can see like icterus. So, in nutshell we can summarize that acute hepatitis are most commonly due to viral regions, or we can say divide into two types. One is infective type, another is non-infective type. In infective type we get it viral hepatitis due to hepatotropic viruses like A, B, C, D that loves liver very much, that is why they affect the liver, but there are another viruses also, those affect the liver, they having a systemic manifestation, but as well as they can produce this like yellow fever, or there are so many other viruses also they affect the liver also. Then like bacterial infections, there are spirochetal, ictera viruses, bacteria, those are affecting it. There are some fungi also, amantadine, or there are some other aflatoxins also, they are produced in our body, they produce the hepatitis syndromes. Some toxins which are goes in our body, like some people eat mushrooms and with that also some toxins goes in our body, or some washing with the chemicals and otherwise they are having the continuous exposure with that. So, they are having a toxicity with the carbon tetrachloride, that toxins are there introduced. Some drugs which we have seen like rifampicin is very commonest drug which is used, paracetamol and other things. Then ischemic hepatitis, then autoimmune hepatitis and metabolic hepatitis. These are the causes mainly for acute hepatitis. Sometimes acute hepatitis like in natural course, chaya, prakopa and prasham, they again come to the normal, like in virus hepatitis A, D, like they come to again normal, and within a span of 2 to 6 or 8 weeks or within a span of 2 to 3 months generally patient's liver gets normalized. But in another patient the symptoms may decrease, but disease may be going inside the body, it may get inside the body, the disease process is continuously going on the body and it may produce a chronicity. Regarding hepatitis, acute and chronic, chronic is described as 6 months of history. After 6 months, any hepatic disease can be termed as a chronic. And then again, viral hepatitis specifically due to hepatitis B, C and sometimes superimposed by the hepatitis D. Then alcohol is one of the commonest cause because the hetu is continuously there. That is why alcoholic hepatitis again becomes very chronic. So, long term drug ingestion also causes chronic hepatitis. Then non-alcoholic steatohepatitis, it is one of the reason by the drugs or sometimes with the help of dietary deficiency like guru, shikta, ahar that produces non-alcoholic steatohepatitis. Then autoimmune diseases are very common for the people, those who are continuously having Raktadushtikar ahar and Viruddha ahar, in specifically those people, specifically in women's, if hepatitis is there, you can suspect autoimmune disease because autoimmune diseases are very common in female. In males also it is common like HLB27 and other you can see, but other autoimmune hepatitis like PCA and other things are more common in females. Then there are some hereditary patterns of hepatitis that we can easily like Crigler-Najjar syndrome or Wilson syndrome or Dubin-Johnson syndrome which makes the liver black and Rotter's syndrome also. So, these hepatitis, whenever it is called as hepatitis, whenever the increased bilirubin level is more than 1.2 or 1.3, that we see will in next slides why and when the hepatitis should be termed. So, it is funny enough, each time the heart and brain fights, the one that always loses is the liver. So, the person who is continuously working, whether there is a fight in between the two management authorities, again the worker who is working continuously always suffers. So, that should be kept always in our mind. So, while diagnosing this hepatitis, previously the examination was in between doctor and patient. Patient tells the symptom, doctor understands the symptoms, he gives the medicine and that is enough. But now in cricket also we get DRS, likewise doctors get ARS. So, investigations is the most important part where we should go. By just seeing the patient, you can understand, get to do the diagnosis of jaundice. That is not a great diagnosis. Any layman or people can do it. It is more better to understand why this hepatitis is occurred. What is the pathophysiology happen inside our body, that understanding clue are given by the investigations. So, the investigations gives us real evidence based medicines, real evidence based treatment. That is why it is the most important part to understand the investigation in the perspective of the symptoms also. So, we have to observe the symptoms as well as we have to observe the reports of the patient. The most important test is serum bilirubin test. Normal serum bilirubin is 1 to 1.2 mg per dl it is given, because that much the amount is produced by the liver regularly. It is divided into conjugated and unconjugated bilirubin. Normally, the unconjugated bilirubin has the most part of it, that is 0.2 to 0.6 up to 1 point also it will do, but an unconjugated point is 3.5. So, unconjugated bilirubin has a more portion of it and conjugated is bilirubin. So, it is more important to understand the total bilirubin increase is how much. If the infection is continuous and liver is functioning well, it will not go beyond the 5 and 6 ml. So, anything which increases bilirubin up to 1.5, it is okay for body, but above 2 and 2.5 it forms icterus. So, when we see the icterus, serum bilirubin is generally about 2.5. So, above 2.5 generally the jaundice symptom starts. Then slowly it may increase when the hepatocellular functions are good up to 5, 6, 7 and generally it goes on. But whenever the serum bilirubin is more than 20, 25, 30, that means severe hepatocellular jaundice is there. So, it means it designates us the severity of injury also. So, that is why the first and foremost test is conjugated, understanding the conjugated unconjugated bilirubin or direct bilirubin and bilirubin markers. With that we can understand the patient is suffering with jaundice. But which type of jaundice, that can be explained with the help of other markers like SGOT, and SGPT. SGPT is aid serum alkaline transfer. So, aminotransferase, these are the basic markers of the hepatocellular markers that will show us that the jaundice is having a viral. Mostly in viral hepatitis, these markers grows more than 10 times. So, it is 10 to 40 if it is the normal, like then 400 SGOT, SGPT, generally it indicates the viral hepatitis. Whenever there is a rise in serum alkaline phosphatase, mostly the lesion is in the biliary channel or biliary tract, and that is why in obstructive jaundice, with the help of gamma glutyl transferase or 5-nucleotase, with this we can see the patient is suffering with obstructive jaundice or not. Then total proteins like albumin, globulin, which are produced in liver, that is a long term marker. So, after some days these markers will determine. Generally the albumin having a plasma half life of 20 to 25 days. So, after 25 days we can see the changes in all these patients. But whenever the albumin is lower on the side, the patient is suffering with liver failure. So, always be cautious whenever the patient's serum albumin is below 2.5. This is a very important sign one must look for. That means patient is suffering with chronic hepatitis from prolonged period, and now he is landing up in liver failure. At that cases should be treated in hospital secondary or tertiary setup only, that should not be treated in clinical setup, or he should see a good physician. So, this albumin globulin ratio, alkaline phosphatase ratio, SGOT SGPT ratio, generally SGOT ALT AST ratio is increased, it is 2:1, that is typically alcoholic hepatitis. So, by knowing the ratios of these also we can understand whether the jaundice is free hepatic or hepatocellular or obstructive type of jaundice, or it is suffering from any other disease which is mentioned there or not. Likewise, acute hepatitis, there are clinical symptoms like jaundice, which can be felt by the doctor, then nausea, vomiting, malaise. The onset is 2 to 4 weeks onset is there. Then in chronic hepatitis, generally it seems asymptomatic. Weight loss due to the albumin loss you can see, then fatigue, hepatosplenomegaly, jaundice. Even in acute also, whenever there is a specific hemolytic anemia, you can see the splenomegaly will be there. There are some serological findings for viral hepatitis like hep A, B, C, E can be diagnosed with hepatitis A virus, hepatitis B virus, HBs, AG antigen, HAV antigen, HAC or HE like antigens you can test, and with this all and with the prothrombin test also, other things you can easily diagnose which type of jaundice is there. So, we will see how we have to identify this jaundice in a clinical sense. Normally, most of the types patients comes to us, more than 60 to 70% cases are of viral hepatitis. Specifically, out of that, hepatitis A and hepatitis R are spread by fecal-oral route, that is means contaminated food and water it is spread. So, hygiene and vaccination if it have any, that is good for it. But even if you do not treat this kind of cases, generally they will get a good relief, or even with the simple medicines also they will get the good relief. Rest, adequate nutrition and fluids are required. The most important part regarding hepatitis A is a self-limiting, that it does not turns into the chronic hepatitis. So, here this kind of cases can be treated well with our medicines, or even if you do not look for that, that is not a great sense. But hepatitis B and hepatitis C, these are the most important part. They come in the body with the infected body fluids. Blood transfusion or blood product transfusion is mostly happens in these patients, and after some days they found to be hepatitis B positive. Their viral load is the most important part where we have to check. If the viral load is more, there is more possibility that patient go into the liver cirrhosis or hepatic failure. So, the blood screening, then HBs AG, even with hepatitis B, that can be transmitted to his partners also with the body fluids contact. That is why it is more important to check the HBeAg and HBs surface antigen in those cases. So, the blood screening improved hygiene, vaccination. So, it can, most important thing is it can be prevented through vaccines. So, any health worker or any going for delivery and like that, they should get vaccination cover for hepatitis B. So, nuclear peptide analysis, and there are some medicines which are also given hepatitis. So, the operative history, if it have and to check the patient hepatitis C positive. So, these are the some things when we find the hepatitis C positive, and hepatitis C generally works well or it gets easily in for 30 to 45% patients, 30 to 40% patient it gets negative. So, it is also a good thing, but when it increases aggressively, it goes, patient again goes into the hepatitis failure. So, we have to see hepatitis B and C. Whenever a patient is having hepatitis B, then superimposed infection of hepatitis D happens in some patients. So, we have to check HDV in those patients. So, these are the very common. Hepatitis E virus vaccine is now always also available, but it is not in all countries. So, the current treatment for this viral hepatitis now is ribavirin, entecavir, platelet interferons, hepatitis B vaccine, immunoglobulins. These are the current treatments, and these are very costliest affairs. So, our main motto or part that we should not make acute hepatitis into the chronic one. Once it goes into the severe stages, then it is very difficult to treat it. So, in early stages, so the early diagnosis is the clue. So, all our institute should start the screening for hepatitis. As soon as they get the patient's hepatitis reports positive, it should be referred to a special hepatology or liver cell or liver clinic in that institute. So, every institute, I request that every institute should start a liver clinic at their place with the help of Charak, and they will have a good results with these patients. So, understanding these patients and to prevent it from going into the chronic stage, that is the most important job which we can done at our institute just by screening a patient. So, I think everybody should do that. With this viral hepatitis, the autoimmune hepatitis, due to disturbed lifestyles, due to faulty dietary patterns, that is mithya ahar vihar and viruddha ahar, now autoimmune hepatitis is also increasing. So, it is sometimes it is a lifelong chronic disease. Relapsing and remissions in this autoimmune hepatitis is very common. Varied phenotype presentations can be seen. It can manifest at any age, but most probably autoimmune in females generally appears in the second and third decade of life. 30 years patients having increased hemoglobinuria, scratching all over the skin, that by saying that lady you can easily diagnose that she must be suffering with primary biliary sclerosis, because previously we were not knowing why it is happening. There is no gallstones, there is no obstruction, there are no other things, and even though the patient is suffering with cholestatic jaundice, that is why it was it was considered as a primary, and all the biliary tracts slowly gets channels blocked, and due to that this happens and patient dies with this treatment. So, if we treat these patients early, diagnose these patients in early stages, even with Ayurvedic medicines, we can have very good results in such autoimmune type hepatitis. People love to have alcohol, and they always get this alcoholic liver disease free. Now, there is a scheme, one free for free. Likewise, alcoholic disease, if you have pegs more than 4 or 5, definitely you will get alcoholic liver disease free in free schemes. Slowly, whenever the alcohol consumption increases, liver cell death, apoptosis will be there, and slowly it turns into the alcoholic hepatitis. Then the changes of steatosis, that it will be changed by the medo dhatu margana, it will be, cells will be repressed by the fat tissues, and slowly the chronic hepatitis and changes of liver cirrhosis happens. So, one has to abstain from alcohol, as well as they should stop, and if the patient stops drinking alcohol within a span of 3 to 4 years, his liver again get regenerated as itself. So, it is our duty to stop the alcoholic beverages in the society. If they take it, it should be in moderate conditions. Like we should follow the government rule that it should be limited to 1 after 2 it should be stopped, and after 3 you should say no. That government rule for family planning, that should be implemented for alcohol planning, so that we will be having a healthy liver. So please help your liver by reducing your intake of alcohol. So always there is a shout to my liver for always taking one for the team. So if you want your all body organs work as a team in a good spirit, you have to save your liver with the these toxins like alcohol and other Ushna Tikshna Dravyas entering in our body. The most common second or third type of hepatitis is obstructive hepatitis. So we know that there is obstruction in the biliary channels, and that is why the liver bile is not coming to the kosha, and that is why the stool is white. But where the obstruction is, to understand where the lesion is, so doctor can understand there is a intrahepatic obstruction or it may be extrahepatic obstructions. So in primary hepatic obstructions, the diseases are primary sclerosing cholangitis, primary biliary cholangitis, medications, toxin and infiltrative diseases are there. The causes of extrahepatic obstructions are gallstones. Generally, gallstones more than 1 to 1.5 centimeter generally causes obstructive jaundice. That is gallstones in common bile duct, then tumors blocking the bile duct, then pancreatitis, then the strictures, then the atrasias, as well as head of pancreas cancer, as well as cancer of ampulla of Vater. There are so many other things which happens in this tract, and that causes the obstruction to the bile flow. So how to understand these hepatic obstructions? The simple way, you can go for sonography, you do a sonography of your patient, then you will come to know, yes, there is a bile stone, this is obstructing. Then you can see his biliary duct. If his biliary duct is dilated, then he is maybe having obstruction in the in the part of ampulla of Vater or head of femur or in common bile duct. If the bile duct is of normal size, then generally the intrahepatic obstruction is there. Even if we can't understand from this point, we can go for ERCP. That is the simple procedure. We can place the catheter into the from stomach, it enters the second or first part of duodenum, and then it goes to the ampulla of Vater. Then it dye is injected, and you can understand the portal portal and other common biliary duct, hepatic duct, pancreatic duct, and where the obstruction is, that can usually rule out. With that, even you can also go for percutaneous transfer to understand it, and better than that, you can go for the biopsy of liver also. So in all these hepatitis, why we are worried about hepatitis? Because the stages which I understand, our liver is healthy, it can have 10, 20, 30, 40, 50, 60, 70, 80% of load takes the liver, but if it is more than 90%, then slowly the liver turns into the hepatitis or fatty liver stage. Fat deposits in and around the liver and leads the inflammation and swelling. And this is the stage where we can have a revival, where we can come return from this stage. But once it goes ahead from hepatic fibrosis, cirrhosis and failures, then the life becomes miserable. So we have to avoid these stages. Whenever we are in a asymptomatic phase or acute hepatitis phase or chronic hepatitis phase, at the same time you should take some Ayurvedic treatments, other treatments, and you should make your liver healthy, and you have to prevent it go from the further cirrhosis or Kumbhakamala or limak type symptoms, because once you reach that stage, it becomes very difficult and liver functions gets disturbed in a very grave, it can produce in a very grave symptoms in such conditions. So Ayurvedic approach for hepatitis, how we can understand all these modern things in Ayurvedic perspective. Here you have seen that all the Sroto Dushti Lakshanas that is given in the text, Ati Pravrutti, Sangova, Siranam Granthayopya, Vimarga Gamanam Chapi Srotasam Dushti Lakshanam. So there is Ati Pravrutti, like bile chains are increased due to inhibition of bile flow or excessive production of bile. Then the Sanga, that is obstruction in biliary tract, then Sira and Granthi Dushti, that is and Vimarga Gaman happens, and that is why this disease occurred. So this Samprapti is very easy. But while understanding it, that every disease should be understood in the following points: what are its hetus that we have understand, what are its symptoms that we have understand, what is the adhisthana where it is happened that we should understand, what are their symptoms that now we have understand. Now evam vruddhi shasa, how it will grow, how it will affect our lifestyle and life diseases, that we have understand now. Now udarkam, that is the uttarkalinam phalam. In future, if we don't treat it, it will go into the stage of from hepatitis, it will go into the stage of liver cirrhosis or hepatocellular cancer. So that's why that udarka we should understand. Now after udarka, evam yogam, which kind of medicines at what stage we should give. And after that, pratikarartha pravrutti athva nivrutti. So if it is a hereditary Klinger-Jansen 1 type syndrome that is due to some, there we cannot do some good treatments. There the treatment is liver transplant only at the age of 1. Most of the times, if it is in fetal part, generally that fetus gets terminated. So likewise, we should understand with the text of Aptopadesh whether we have to go ahead for disease or not, whether to treat this disease or not. And with understanding all these Harrison's Aptopadesh, Charak's Aptopadesh, Sushruta Aptopadesh or Ashtanga Aptopadesh, we should proceed further. We should not rely only on one parameter. We should rely, we should take Bahuvidahi Pariksha Sthapayanti Iha Nirnayasa Siddhanta. So it should be treated, it should be investigated with the multiple aspects. Then only we can treat it in a better way. So before going for the treatment, we should understand the hetu and the symptoms. The hetu generally toxins, madhyapan, veg vidharan, ushna tishna ahar, guru abhishandi bhojan, divasop, ratri jagran, kshata, or viral or bacterial or fungal or protozoal like amoeba like or liver fluke like symptoms or some other causes that we can have. But for the treatment, we have to understand all these things and we have to categorize in. So mostly all these causes altogether manifested in 2 types. One is Koshtha Shakhashrit Kamala Lakshanani, another one is Shakhashrit Lakshanani. So understanding this huge tree, but only 2 types generally they are present in our symptomatology. So that 2 types are given in Ayurvedic text. So after understanding all these clinical conditions, we have to understand the symptoms in 2 perspectives, specifically Shakhashrita Kamala Lakshanani, Shweta Varchasvam, that is the stool becomes clay colored, Haridra Netratvam, you can see the icterus, Haridra Mutratvam, that is the urine, Haridra Tvakam. Then these are the specific symptoms for liver disease symptoms, liver obstructive symptoms, and general symptoms in body like Atopa, Vishtambha, Hrudaya Gauravam, Daurbalyam, Alpagni, Parshvarti, Hikka, Shwas, Aruchi and Jwara. These are all symptoms given in our Ayurvedic text. In Koshtashrit, where Bhrusha Haridra Netratvam, here the main important part is stool is also yellow colored in Hepatic Jaundice. Bhrusham Haridra Netratvam, Bhrusham Haridra Tvakvam, Bhrusham Haridra Nakhatvam. Bhrusham is significant. It reaches to 5 to 6 bilirubin goes, then only this Bhrushatvam you can observe. That Rakta Pita Purishatvam, you can see whenever there is a primary or you can say hyperbilirubinemia increases due to hemolysis, then only this Rakta Pittvatvam, there is hemoglobin present in urine. That's why the Rakta Purishatvam is and Rakta Mutratvam is specifically mentioned in Koshtashrit. It is not mentioned in Shakhashrit Kamala, that Raktatvam. Bhekavarnatvam, Hatendriyatvam, that may in future it may leads to coma-like conditions. That's why Hatendriyatvam. Daha, Avipaka, Daurbalyam, Sadanam, Aruchi, this kind of symptoms are described specifically. Whenever it goes to the cirrhosis or other next stages, then other Krishnapitamuttaram, Bhrisham Shotha, due to albumin decrease, there is a extracellular Shotha is there, and due to albumin decrease, Bhrisham Shotha is there. So, Saraktakshitvam, Saraktanenatvam, that is all prothrombin and clotting factor goes down. So, prothrombin side goes down as well as PTT becomes longer. That's why Saraktakshitvam, Saraktanenatvam, sometimes due to increased esophageal varices, there is a Sarakta Chardi, Sarakta Purishatvam, intestinal bleeding is also there. That's why all these symptoms which are given our text, if you understand in a positive sense, definitely it will give us a good clue towards the diagnosis. So our text has given 2000 or 1000 years before all these symptoms, but we are not enough sincere to understand these symptoms in this modern perspective. Now, with the help of third eye of modern medicine diagnostics, we can understand all these symptoms in a scientific way. So, scientifically the medicines which are used in these conditions can be specifically used for specific type of disease. So, that indications or lakshanas which are given in our text should be studied thoroughly, and accordingly we should treat and understand the status, the severity of the disease or staging of the disease can be done. So, while treating patients in Ayurvedic perspective, according to Ayurveda, the liver is also called yakrut. Yaha संयमनम करोति, नियमनम करोति. It controls all the metabolic procedures. That's why it is called as yakrut. It is predominantly by pitta dosha. Any transformation in our body that is attributed to pitta. That's why. Aggravated pitta dosha causes excessive bile production or blockage of flow in bile. It is given in our text that पांडुरोगी यो अत्यर्थम पित्तला निषेवते तस्य पित्तम असुग्मावसम दग्ध्वा रोगाय कल्पते. So that is not only production blockage of flow of bile, but it is excessive bile production due to this is also most important part. So regular most important word is excessive. Regular bile production is there, but when it becomes excessive and blockage will be there, it will become into the disease stage. This affects the enzyme activities responsible for absorption, digestion, metabolism. Not only for, there are some bile accepting transporters are there, gluconeogenesis transferase like enzymes are there. So, in all these enzymes there are some changes generally happens, and that is why this disease gets produced. So, aggravation of this pitta dosha causes liver disease such as hepatitis, cirrhosis or fatty liver, which we have seen. So, according to test which we go, like first and foremost, like our company's name, it's a Charak Samhita is the foremost test from where we. So, Pandurogi Atyartham Pittala Nishevate. So, first condition it is given as Pandurogi, but it is not like that. Ashtanga Hridaya has given that Panduroga Dhrute picture. If you don't have anemia, even though this can happen, but it mostly happens in Panduroga. So, this is a pre-hepatic jaundice, that is a hemolysis jaundice. We all know bile is produced in the liver with origin or in the spleen. So, if we understand how bile is produced, that can be easy understand. For that we have to understand the samprapti of Pandurog. Suppose yara pittam hridaya samavistam, like that samprapti is given, but it is important to understand doshe pitta pradhanastu kupyanti yasya dhatushu शैथिल्यम तस्य धातु नाम गौरवम चोपजायते ततो वर्ण बल स्नेहा ये चापि अन्योजसो गुणः व्रजन्ति क्षयमत्यर्थम दोष दुश्च प्रचर. When I see this samprapti in the modern perspective, I understand doshe pitta pradhanastu, whenever the pitta pradhana dosha increases there, kupyanti yasya dhatushu, whenever it is increased in the rakta dhatu or its moolasthana yakrut and pliha, Shaithilyam tasya dhatu naam. Shaithilya, that means the gati of that RBCs get destroyed. That becomes very sluggish, and whenever that RBC becomes sluggish, gauravam chopajayate, that gets entangled into the biliary channel of biliary roads are like that in spleen and in liver, that gets entangled. And whenever that RBCs, this happens with the old RBCs generally. Whenever these old RBCs get entangled into the channel, at the same time these things gets obstructed, and then these are engulfed by microcyte, macrophages or other cells in our body, and that RBCs get destroyed. So, shaithilyam tasya dhatu naam gauravam chopajayate. Once the destruction starts, it goes into the three stages. Tato varna balasneha. So, varna, that is the hema part, is extracted separately, and that varna part is separated, that hema part is separated. The remaining part, that part porphyrin ring, is turned into the bile. So, this is scientific production of bile is described in our text in this shloka. So, tato varna bala, that means the proteins which are there always means synthesized by the livers. Then the remaining part like cell membrane and other things, that are the lipid. So, varna bala sneha, sneha is lipid part of that. ये चापी न्योजसो गुणः or other products which are there in body that get destroyed, and after that तो वर्णबल ये चापी न्योजसो व्रजन्ति क्षयम अत्यर्थम. Whenever there is atyartha kshaya, that means excessively it happens, then only it produces bile. So our tests are very scientific, they are given it in a better test. We have to understand all these things in the modern perspective light, and then we will come to know whenever the excessive bile is produced, liver is unable to handling that bilirubin load, and at that time this kind of or jaundice is appeared in the blood. But liver is very well manage these things by excreting. The liver cells are working well, hepatocytes working well, then only the bilirubin increased will be consider little bit higher, that means up to 4, 5, 6 like that. But it gets obstructed through the biliary channels, then the biliary count will increase. So it is understand due to Pandu, that is due to intravascular hemolysis or extravascular hemolysis, this bile is going to increase. So one of the part of producing hepatitis is understanding the Pandu rog is also. Tasya pittam asrugmausam dagdva rogaya palpate. Then the symptoms which are given, Haridra Netra we have seen in the last slide, that is some constitutional and liver specific symptoms. These are given, and if you don't look into the initial stages, we don't treat in a proper way, then the Tandra, Moha Samanvitaha, the semicomatous stage can arise in the last stage, and patient may die of cirrhosis or hepatocellular jaundice. So all the things are given in this Charak Samprapti. So according to Ayurveda, Kamala term is mentioned to describe various range of liver disease or hepatitis. Kamala is a disease of Raktava Strotas. Kamala literally means loss of desire. Kama anlati the Kamala. Kam means to wish. Our wishes like eating, drinking water, doing daily activities, that deranges. So Kamala is caused due to impairment of Pitta dosha, either by excessive bile production. That are the two important parts which we have understood. Even in Sushrut Samhita, all these things are given, and then specifically they are given that Lagharaka, Alasaka or Halimaka, that increased due to Vata Pitta dosha. Halimaka name is also given in the text. So Ayurvedic diagnosis, with understanding after all this modern tree of diagnosis or understanding, it comes into Bahupitta Koshta Shakha Shrit Kamala, Ruddapatha Kamala, Kumbha Kamala and Halimag. These are the 4 types. So how to treat this Bahupitta or hepatocellular Kamala where excessive hemolysis has been occurred? The text after Pandurogin text, it is given that Samshodh Mrudubhistiktahi Kamalitu Virechanahi. So there should be Samshodhan, there should be given purgation, but it should be Mrudu, soft drugs like Aragvadha, like Draksha, Ikshurasa, that kind of drugs should be used. Tiktaihi, that should be bitter in taste so that it will protect liver well, and Kamalitu Virechanahi, like Tribandi Virechani. Tribandi and Trivrut, that can be given for virechan. So most important thing, as biliary channels is working normal, in this stage your aim should be the smile purgation should be given to the patient. So the excess bile which is produced there should be eliminated through virechana. So this is a very scientific and simple treatment just to increase this pitta in some kind of hemolysis. Mahatikta, Panchagavya, Kalyana Ghruta is given in some specific stages where there is a intravascular hemolysis. At that stages it can be given. Then the Shaman Chikitsa with simple drugs like Mauktik Pishti, Praval Pishti, Kamdudha, these are the very simple drugs. These are being given in this stage, and Virechan is the mainstay of treatment for this specific Bahupitta Kamala. Here you can see the specifically there is some increase in Pitta dosha, that is why only Virechana is required. But whenever it goes towards the Ruddapatha Kamala or obstructive jaundice, so in hepatocellular we can give Virechana, but in Ruddapatha, whenever the biliary state is impaired, we have to go for the treatment of obstructive jaundice. In this specific type, Apitta Raga Chakruto Yatha Bhavet, that the bile should come into the gastrointestinal tract. It is given that in our text, Antak Koshta Mahasrota Ama Pakvashara. In Antak Koshta, bile should enter. It should not go, as it is a toxic material, it should not go into the circulation without inconstituted stage. So it should be taken out through the biliary system. So how to bring this dosha from Shakha to Koshtha. That is the most important part to understand. Vruddhyabhishandanat Pakat Koshtham Vayasya Nigrahat. Vruddhi, Abhishanda, Pak, these are the things which will bring dosha from Shakha to Koshtha. So, to increase the dosh, it is the more important treatment. In Bahupitta Kamala, Virechan was the basic treatment, but here to increase the dosha, Vruddhi is most important part, which is in the text they have used this idea. We have treated so many patients of obstructive jaundice, and within a span of 8 to 15 days, we have very good results with the in all types of obstructive jaundice patient. You can leave the patients of hepatitis elder and other jaundice patients, but those who have intrahepatic and other changes are there, then this specifically Katomla Lavanai Rasaihi, specifically Vruddhi should be done. Pitta Vruddhi, Kapha Shamana, that is the most important part of this treatment. So, Pitta Vardak Chikitsa for Pitta Vardhana, Katu Rasa, that is Trikatu, Amla Rasa, Lavan Rasa should be in excessive quantity. Here the quantity is most important, 4 to 5 grams of Trikatu, 4 to 5 ml Nimbus Rasa, then 4 to 5 grams of Saindhava, that is in increasing dose we have to given. Then only Pitta and Kapha Vruddhi we can have one, and for first few weeks this should be the only treatment, and after that whenever there is a in Koshtha you can see the bile is coming, then only we should go for other treatments. Till that time Bhedan with Kutki, Shiva or Haritaki, that works. Even in some cases previously it was Shiro Gaurav and other symptoms were there, at that stage Nasya Chikitsa was performed. Devdali Nasya was given. Even in nearby Lonavala, they were given Devdali Nasya, and after that Nasya 10 to 15 liters for water, there is a rhinorrhea happening through the nasal discharge, and then the jaundice disappears. So, many people have experienced these things, that the magical effects of Nasya also. Now, we are not utilizing in our institutes, but we have to work scientifically on those part of Ayurvedic treatments also. And after giving all these things, to avoid Vyadhi Punarbhav, we should use Rasayan Chikitsa with some specific drugs for specific types. So, in hepatitis B, C and D, they go into the chronic stage, so prolonged treatment is required in such cases. So, Falatrika, Amruta, Darvi, Nimba, Bhumya Malkikvat with Gomutra Anupana should be given continuously to this patient. Acute stage, the treatment is needed for 8 to 15 days or up to 1 month. Within 4 to 6 weeks, generally these patients have a good relief, but every 6 months you should check for HBeAg, that is for Australia antigen hepatitis B, and then you can go ahead and you should keep the records of the patient. You should go for the viral load also, and you see that your treatment should reduce it. If it goes above 5 lakhs, 4 lakhs and like that, the patients may need other treatments with the help also. But if you start in initial phases, the patient shows good regression in viral load also. Now we have got some patients, their viral load has become absolutely nil, up to 400, 300, 400 only viruses are detected in their blood. With hepatitis A and E, that are the self-limiting conditions. So, simple Sharkara, Tivrut or Vasaguduchadi or Falatrikadi Kashai or Murtuvika and Amal like drugs will help in these cases, and this will resolve very easily. So, need not to worry about these cases. Then in autoimmune hepatitis, generally we use Suvarna, because Visha should not be increased on our body. Whenever Visha increases, there is a increased in other things. So, in autoimmune hepatitis as well as in alcoholic hepatitis, the Visha and Madhya having the same gunas, and Ojo Kshaya happens in those cases. So, Suvarna is the Ojaskar Dravya which is used in such cases with specific precautions that should be given in specific tests. So, Gomutra, Trifala, Praval Panchamrut, Tapyadi Loha, Yogaraj Gugulu, Punarnava Mandur, Shatavari, Chinnaru, Hadi Kashai which is used in Vata Rakta, then Patol Katu Rohinyadi Kashai. This is the main part of treatment. Patol Katu Rohini, Chandanam, Madhustravaguduchi Pathanuitam, Nihanti Kapapitta Kushtha Joran, Visham, Vamim Arochakam Kamalam. So, whenever it is produced like in a Visha form, there is autoimmune works as a Visha or Gada. In those stages, we can use this kind of Patol Katu Rohini gives good results. In drug-induced hepatitis, there is a Trifala, Daru Haridra. Daru Haridra is a very good drug in drug-induced hepatitis. Katu Rohini, Ayoraja, Kshaudra, Sarpi. Just we are discussing about these things. Modern people are ahead of us. They have taken out piperazine out of people and now they are using it in with rifampicin. So, rifampicin with piperazine, that is available since last 10 years in the market. But we are not utilizing and believing in our drugs that the dose should be reduced. So, now we are doing so many trials in other institutes also, that with the Ayurvedic drugs, what are the toxic drugs, their dose should be decreased and their efficacy should also increase. So, with this kind of drug research is also continued in many places. So, drug-induced hepatitis can be well treated with the Ayurvedic treatment with these simple drugs. So, that is the most important part where we can treat. In alcoholic liver disease also, we are having very good or excellent results, and for all these patients, if you treat with Ayurveda, definitely their cirrhosis and other conditions can be prevented. If the patient is having splenomegaly, then Mandur Vatak, Rohitakarishta, Varangakshar is also one of the good drug. There are some Rohitakarishtas are given, or Shatpalaghruta Sarpi that are mentioned. For Doshanulomana, Navayas, Gomutra, Lohabhasma, that should be given. For Anupan, for all patients, Dhatri Avaleha, Drakshaleha should be given to those patients. So, Rasayan and Punarbhav Chikitsa, Vardhaman Pippali in titrated doses specifically, or Vardhaman Guduchi Rasayan, which is a very good Rasayan in all these patients. Even Vardhaman Daruhridra Rasayan can also be given for 1 mandal, and with these all simple drugs, you can see that all the liver markers come to the normal. SGOT, SGPT, ALT, whatever markers, serum alkaline phosphatase, serum GGT, 5-alkaline nucleotide. We have worked more than 1 to 1.5 lakh patients we have worked, and we have observed that all these clinical markers are going to get relieved with the Ayurvedic treatments. So, this is the most important part, that all our medicines are evidence based medicines. Just you have to observe it. As we have not observed it, it doesn't become unscientific. So many people are observing it, and nowadays everybody is behind the evidence based medicine. So, all these medicines are now used as the evidence based medicine. These are the simple drugs. Now, I will give you evidence based medicine simple one report. Like Bhumya Malki, it is a having phylantine Nirurin is the comment in that. Then Giloy, that is Dr. Sharadun Dahanukar worked, and that's a phagocytosis and everything. It works on Kafar cells. It works very well for all hepatic enzymes. The Kutki is the best drug to reduce the drug effect and other effects also. Amalki is a very good to result a hepatocellular jaundice. Daruhridra, it is good for remaining whenever the fat increases in the liver, we should use Daruhridra. Definitely the steatosis or NASH disease, we will have a very good results. In instant or in acute viral hepatitis, Calmeg produces wonderful results. So, all these medicines, when we work together, then we have to take crux of all these medicines, and we have discovered that hepatitis free future with these drugs, a drug produced like Levomine, which is clinically and scientifically tested. It is having all properties of anti-inflammatory, antioxidant, even antiviral has been tested, then immunomodulator and hepatocyte regenerative changes that also been occurred in this session. So, we have so Charak has described near about 36, Sushruta has described near about 60 herbs, Charak has described near about 60 to 80 herbs. So, among all these drugs, some selected drugs, 18, 19 drugs we have selected and prepared a medicine named as Levomine, which efficacy is proven with the nuclear medicine based hepatobiliary scintigraphy. So, the most modern, unique, unmatched hepatobiliary has given record that within 20 days this Levomine helped in complete recovery from the hepatotoxicity, hepatic extractions, efficacy and hepatobiliary dynamics were normalized. So, the whatever changes in animals which were happened with this test, it is proved that the Levomine has completely regressed all these changes. So, this is a drug which works on at cellular level and improves the functional competence of hepatocyte. So, hepatocyte is a basic cell of the liver. When you increase each cell, definitely the organ works well better. So, this work has showed us that there is a evidence based medicines now coming from Ayurveda to prevent all these viral hepatitis and other things. So, fortified with these 9 hepatoprotective herbs, the Levomine having Kalmek, Bhumyamalki, Pundarnava, Kutki and better manner. So, dosage is 1 to 2 tablet that they will explain, or you are the doctor, you can decide it better how to use these drugs, but this combination is today is available. So, I thank you to all for this your patience listening, observing, understanding Ayurveda in the clinical, modern and perspective and understanding this disease, and always keep the drug Levomine in your mind for hepatitis future, and thanks for taking care of liver with our drug Levomine. Thank you once and all. Thanks a lot.
So thank you, Dr. Inamdar, for your covering everything in 1 hour capsule to take care of full insight of hepatitis as a disease and how to take care of disease as a hepatitis with what sort of Ayurvedic drug. And there are, as a technical report just comes to me, there are 7,900 students across the country is listening to you, and there are multiple questions are popping up in our chat box. And today we have our medical head from Charak Pharmaceutical Mumbai, Dr. Manisha Goswami. She is going through all the plethora of questions. So I request Dr. Manisha Mishra Goswami to take all those questions, because topic is so interesting.
Yes.
So over to Dr. Manisha here.
Thank you so much, and thank you so much, Dr.
Yes,
Inamdar. I will not waste one single moment. And my first question, since you are MD Rasa Shastra, somebody is asking me, what is the role of Rasa Aushadhis in liver cirrhosis, gallbladder stone and liver carcinoma, and what is your prognosis and thought process for treating such Yakruta Vyadhi with Rasa Aushadhi?
At least you should join 1 or 2 hour session for this question. So there are so many things all together, but I think as a Rasa Shastri we have treated. Now you have seen so many toxicities in liver with different kinds of drug, but nobody and never mentioned that the mercury is toxic for the drug, Naga, Vanga is toxic for the drug. There are no mentions they are given like that. Only some mentions regarding copper are there. But if we use judiciously our product, like I think since last 75 years, so many persons have used Arogyavardhini having Tamra liver, and they are having excellent results. That means it is already proved that so many people, and that are not trials, means animal trials. There are trials on humans, those who are having and suffering with hepatitis, and now they are giving with Arogyavardhini Rasa, which Rasa Gandhaka Loha Brashulbha Bhasma Samaushakam Trifala Diguna Ajja Trigunam Tu Shilajatu. So every which is given in Rasa Shastra used, that is used in this Arogyavardhini. So if Arogyavardhini is giving us positive results, then it's good. When the biliary stone is more than 2 centimeters, it should get operated. When it obstructs or gives patients more than 3 to 4 times pains in the liver, then it should get operated. Then what is the third question? In that?
Liver carcinoma and the prognosis.
Liver carcinoma and prognosis is very bad, or you can say prognosis is guarded. We don't have evidences that we have treated liver cancer patients at their stage, but we can prevent those stages. There are some cases, but they are not in 4 digits. At least we claim that we are curing this disease, we should get data in 1 year. I think we can start some institute which will keep all this data in next 20 years, like he was given his life, like Dr. Bloomberg. We have to share and care our life for these problems, then only we can give. So this is an initiative from Charak for the same thing, that we should get inspired with all these things, and we should start an institute based treatment, and we will have a good data regarding those things. So we can treat these conditions, but we don't have any data supporting us that we have treated this much cases and now they all have cured. But I think regarding cancer, we should forget the word cure. Whether we can give good means quality of life and care, that is the most important part, what I understand in this 30 years of practice.
Rightly said. Now this is a very strange student query, which
Yes.
I will ask for all the students. Is it safe for a medical student to do cadaveric dissection, meaning anatomy practical in bracket, without hepatitis vaccination?
Yeah, it's safe, generally our immunity takes care of all the things, but I think every medical worker should go hepatitis B vaccination. So that's the most preventive thing which, so prevention is better than cure. We always give our logo like that. So prevention, well, it is given even in our hotel, it was written that 1 ounce of care is more than 1 pound of errors. So you should take care first. That's why it is a very safe, it doesn't have any other side effect. So we should get vaccinated for hepatitis B if we are working in medical field, because we don't know with whom we will get. Even if the person she or he gets married and gets hepatitis B afterwards, so that will also be protected with his son, not only the cadaverics.
True. This is a very interesting question. So I am asking, this is by Mohammad Kadir from Hyderabad. He is asking, he has a patient with bilirubin of 10 by birth and eyes are yellow every time but no severe symptoms, but when hemoglobin rises above 10, symptoms appear.
Yes, this is a Gilbert syndrome. Most probably this is a common and mild hepatitis. Sometimes their liver bilirubin increases up to 2, 4, 5, 6, but there is no any changes of hepatocellular damage. If it is not there, we need not to worry about these things. He has to assure that whenever it increases up to 10, give some simple medicines like Virechana, Koshta Shaka treatment. He should take Tirutleya or some other medicines, and that's enough. No need to go for investigations routinely, because that is a genetic diseases. Whenever there will be stress, whenever there will be dehydration, whenever there will be some physical stress in his mind, then only he will develop all these symptoms, and again his bilirubin will rise. His hemoglobin will not rise above 10 because he has got some genetic defect in his body. One of the gene gets defected, but it's a mild defect. That's why it doesn't needs any treatment, as it is not producing any hepatitis. So whenever we should worry that when it produces hepatocellular damages, whenever the other SUT, ALT, other liver markers, specifically these are hepatocyte markers, are ALT. ALT is most, ALT, L always you keep in the mind, that's L for liver. ALT increases, then only the liver hepatocytes are going to be damaged or necrosis. Whenever these things happens, we have to take care, we have to intervene, we have to give best drugs, and we have to avoid this process. So he may be suffering with but miss that simple syndrome, Gilbert.
Yeah. So I think you got the answer there for everybody. Now this is also very interesting. Vaidya Divesh Desai is asking me, does coronavirus increase the viral load of any hepatitis, specifically hepatitis B? I have noticed that those who are stable with Ayurvedic medicine, their viral loads become high during COVID times. Clinically, they all were normal without any complaints. How is it possible?
Yeah, it is possible. Whenever you get any infection in your body, your immunity decreases. So the viral load may increase in your body. But that doesn't mean disease prosperity and severity is increase. That's why we always see what are the symptoms in our body. The disease severity if increases, then we need to intervene. So that's why the clinical knowledge is important. We should not treat the reports or papers. We should treat the patient. If the patient is showing some major changes in his body like hepatic necrosis, other markers are increasing, then only we need. With the corona or any other infection in your body, srotans anneshya daru nahi. If there is a srota, any other srotas drishti, you can see the increase in hepatic disorders also. So all over world, because all body gets all the nourishment and what are the precursors from the liver itself. So whenever that gets hampered, definitely our body is going to get hampered. Specifically in lung cases, whenever it is increased, generally we can see, because both are shonita fena prabhavaha fupusaha, and so whenever the means organs which are embryologically derived from the blood or shonitaja or brudu dhatu, definitely those gives effect on liver.
Yeah. So there's a compliment from Dr. Geeta Joshi. She's saying well explained by you, Dr. Inamdar. She's also giving a suggestion and a compliment to Livomin. As an Ayurvedic doctor, I would like to prescribe tablet Livomin during pregnancy also. Patients, they will deliver good and healthy babies free from neonatal jaundice. Please consider. So,
yes, definitely.
There is also, continuing with Livermin, can we prescribe the Livermin drops to newborn baby suffering from neonatal jaundice? According to me, yes. Dr. Inamdar, you want to
Yes,
add?
you can give that one, but phototherapy is most morely indicated, because even mother's milk has a separate galactodirase, that specific means specific chemical in the means mother's milk is also there, that related bilirubin, and patient gets good effect from the mother's milk also. So specific that I don't remember its name, that is in mother's milk, that is also. Even in Kashyap Samhita they have mentioned in 25th Adhyay and 35th shloka that pitta kamala, pitta dushta rakta, that produces kamala. So in such cases our drugs are very safe, and we can easily give these medicines and we have good result.
So on a lighter note, Dr. Pradeep Kumar has asked questions. There was a slide for alcoholic liver disease. He's asking, what does 4+ drink mean? Can you specify the quantity?
I think everybody's size is different, but generally according to the general measures, 30, 60, 90, that is the measures everybody counts. So according to that, 4 means 120. I think you are good in maths enough, so you can calculate yourself and abstain yourself from alcohol. That is the message.
There is a question, Livermin side effects. So as far as the studies that we have done, there are no known side effects as yet. It's absolutely safe and very effective. So I have answered that. How can the Livermin work during treatment of a patient infected with hepatitis B virus? I think Dr. Inamdar has explained it beautifully with all the herbs, so that has solved your query. Why we see Ojakshay in Pandu Samprapti and not in other like Rajakshma?
So in all diseases in final stage we can see Ojakshay like Bibheti, Durbalo, Bhishnam, Dhyayati, Vyatitendriya, Bichchayo, Durmanastasya, Bhavet, Kshamashi, Tatshay. All these Ojakshay symptoms can be happened, but specifically in Pandu, because Rakta Oj is produced from Sara of all Dhatu. Other dhatus are produced with Rakta. Now we have not discussed all these things in detail, that Kedar Kulya Nyay, Khale Kapota Nyay or Kshiradadhi Nyay and Upasnehan Nyay. All these 4 Nyayas are observed well in liver functions. So the dhatu sar which is going to happen from the liver, that gets diminished. That's why in Pandu Vyadhi or asa dhatu, the Raktava Mula Strotas Vyadhi is there. That's why other dhatus and their sarata is not has been observed. That's why due to low sarata, Ojakshay is the consequence or udarka of all these symptoms. So it's very simple. If we understand all these things, that dhatu is going to be produced with from Rakta dhatu to other dhatus. If that is not been produced properly, then how this Ojakshay means OJ will be developed. So regarding this, for OJ specifically, so in Pandu also you can observe all these symptoms. Bibheti, that palpitation is there. In Pandu you can easily observe that. Durbalo, it doesn't have that carries. So any patient is having weakness, general impression is having low anemia is the commonest symptom which we often. Even if you give random blood samples of 100 Indian patients, you will see more than 70% are deficient in serum ammonia. Don't go on hemoglobin, but serum iron levels are very low in Indian populations. Normally it is 65 to 180, but generally we will observe below 60, below 50, below 40 in all other conditions. This is the most important thing. So in all these Pandu dhatu means Pandu patients and dhatu patients or Raktakshay patients, we observe Ojakshay, and that can be treated with the simple Annabhedi Sindur, Kasis Bhasma, Loha Bhasma, Mandur Vatak, Yogaraj, whatever you have to give, but give it for 6 months, not less than that. Then only you will see the rise in serum iron levels. Otherwise, with all other drugs, you will not see that the serum iron will work rapidly. But with all these medicines for prolonged period, if you give, then you can have a good Rakta Dhatu, then Oja Vruddhi will be there. Then the symptoms will disappear.
So this is this was left out. How to deal with hepatitis in pregnancy?
See, in pregnancy mostly we take all the precautions, but even though simple rise in markers, liver markers, that SCOT, AST happens, and if it is a you can say mostly when you say in pregnancy it's a acute hepatitis. So if it is a A and E type, then it's very easy, but if it is a B and C, it should get vaccinated first. So every pregnant woman gets vaccination for hepatitis B, and baby also when delivers that. So whenever it happens, you can give the medicines which are prescribed as very simple medicines which can be used in pregnant lady also very effectively. So there are very good medicines, like you can say the simple drugs like Shatavari, Chinnaru, Hadi Kashaya that we have mentioned in pregnant ladies, that works well, as well as Shatavari Mandur, that is a well, Navayas Loha, that is given for pregnancy also and always in continuous sense. Then Suvarna Malini Vasanta, then Madhu Malini Vasanta, which in first, second or Laghu Malini in third trimester, that also helps to reduce the hepatitis also. So these are the simple things, and with the simple medicines like one of the Kashaya which is mentioned, I forgot to mention, that is Bilva Kashaya, is very effective in pregnancy to reduce all these things. Likewise Sampitta Shamadra, Durva, Ananta, Vasa, like Ananta, Sariva and Durva, that can be given to a patient to reduce fear. Then Amalki is the drug of choice which can be easily used in pregnancy. So many drugs which we have given that can be easily administered in pregnancy. So you can use all these array. We have got so many things. So we have to decide which one is better for our patient according to his prakriti or constitution, and her constitutional medicine you can give to her, and definitely she will be cured with this acute hepatitis, and she will not develop in future hepatitis. But for her progeny, we have to give hepatitis B vaccination, so that in future he will get a prevention from the any other disease if in future if he is going to cut.
There are repeated questions on gallbladder stone. Do you want to say something on that? How to treat?
Gallbladder stone, mostly the obstruction doesn't makes a obstructive jaundice in many of the cases. If you see 100 cases, only 3 or 4 patients you will see with the gallbladder. Gallbladder stones can be dissolved, but patients have to take treatment for 1 to 1.5 years, at least 1.5 years. Some patients may split if the stone is about the size of 1, 2, 3, 4, 5, 6 mm, but above 8 mm or 1.5 mm, generally that stone doesn't go through the biliary duct, common biliary duct, because it gets obstructed in that side, and sometimes patient may have to operate. Even after removal of gallbladder and system gallbladder also, some patient may get stone intrahepatic duct or like right hepatic duct, they get the stones obstructed, and even they can be removed with the help of ERCP. So we have to decide according to the patient's wish and will to follow the patya for prolonged period and see the consequences. If they are the mild and if they don't produce any other symptoms, don't touch them, just give simple medicines, avoid all the take the all precautions generally which we give for the, because it is produced with the cholesterol. So you have to reduce all this. So may the Kshayak drugs, specifically Guduchi and Darwaridra, if you go for prolonged period with some ksharas like Lanakshar or any other Gomutra Ritaki, it works in better way. So we have to, according to the patient, we have to take decision. There is no simple or single rule for each and every patient regarding gallstones.
So I think this evening I have to thank Dr. Inamdar, and I will hand it over to Mr. Sharma to thank everybody for being with us.
Yes, thank you everyone.
Yeah, good afternoon viewers. At the onset, I would like to, on behalf of Charak family, I would like to express our gratitude of thanks to today's speaker, Dr. Inamdar, for enlightening us about the pathophysiology, the diagnosis and also the treatment of viral hepatitis through evidence-based Levomine syrup and tablets. I also express my gratitude of thanks to Dr. Manisha for her support in today's webinar. Thank you, Dr. Manisha. Also would like to express my gratitude and thanks to Mr. Prashant Yevle and the entire marketing team, because they have concepted it and they have ensured the success of this webinar. So thank you very much, my marketing team. And also would like to express my gratitude and thanks to all the office bearers of the academic institutions, because of their valuable support, we have been successful in conducting this webinar all across the country in more than 55 colleges. So thank you all. Thanks, my sincere thanks to the doctors, students, PGs who are physically available to attend this webinar. So thank you very much. And also here I would like to put on my request. I am aware that most of you would have definitely filled in your registration forms, but if not, then I request you all that please fill in the registration form, that we will be offering you the e-certificates as well. Also would like to express my thanks to the trade doctors, because they have not been physically present, but yes, online they are there, available and listening to Dr. Inamdar on this lovely webinar. Thank you very much, doctors, for your presence as well and taking time out of your practice to be a part of this webinar. Thank you very much. And of course, my special thanks and my sincere appreciations to my sales team, because this is the team who has taken a lot of painstaking efforts throughout the month of July to ensure that this webinar becomes a success all across the country. And I am very proud to express that there are more than 8,000 participants who have entered and registered, and we are viewing this webinar. So my appreciation, very well done my team, my sincere appreciations to you all. Right from the sales manager to the DSM, to the regional manager, to the ASMs, and also my DSAs as well, because all have worked as a team in tandem to ensure the success of this webinar. Now, before closing this webinar, I would like to put my humble request to all the practicing doctors that please give your valuable support to Charak Pharma, because we are the organization who have always been putting our best efforts to give you the best of the solution, and that also evidence based. So request remains for our brands, though this seminar is related to viral hepatitis, but I would like to mention the name of my proud brand M2 Tone, which is the India's #1 prescribed menstrual modulator. We do have our Hyponate, which is an herbal insulin sensitizer, which is very and highly effective evidence-based medicine for PCOS cases. So thank you very much, doctors, for prescribing our brand. We do have our Adizova, which is for male infertility, and that also has been tested through CASA study to ensure that yes, the efficacy of the drug is there at the sperm level. We also have wonderful products in the form of Gum Tone, which is for the oral health, for the teeth and gum. Is a wonderful product as well, and a very big product for us. We do have Manol as well, which is a general health tonic, and especially during COVID times, this is the product which has done so well and helped many of the patients during the recovery phase in COVID. So there is a lot of list of products, that wonderful brands that we have, which are there for decades in the market and have helped the patient to recover fast and to take care without having any major side effects. So once again, thank you very much to all the viewers, and also to the entire team. Dr. Inamdar, thank you very much once again, Mr. Prashant and Dr. Manisha, and also my technical team as well, because they have also supported us very well. And I hope that in the field that you did not have any sort of a technical issues. So thank you very much, my technical team as well. So thanks. With this, we would like to now to close this webinar. Thank you very much.
Thank you. Thank you.